if you feel that you're in carrying out your duty, you will get killed. My God, shoot him first.
Since the government has launched a war on drugs, this has resulted in the extrajudicial deaths of thousands of alleged drug dealers and users across the country. Another one has been added to the list. Talking about drugs, we are about to share some interesting facts and why the improper use of it leads to the user's demise. These drugs are considered as CNS stimulants. They stimulate the nervous system, increase energy, improve attention and alertness, elevate blood pressure, heart rate, and respiratory rate, decrease the need for sleep, reduce appetite, lessen inhibitions, and it also improves mood and may induce a sense of euphoria or the experience of pleasure or excitement and intense feelings of well-being and happiness. CNS stimulants are quite amazing, right? No wonder they are abused by many. So now, let's go deeper. Let's talk about how they work inside the brain via cellular level. They can block neurotransmitters reuptake. An example of this is cocaine. Another would be they can promote neurotransmitter release, like in the case of amphetamine. Another would be they can block metabolism. An example of this is the MAO inhibitors. And lastly, they can antagonize the effect of inhibitory neurotransmitters, like in the strychnine. After knowing how they work inside the brain, let's further talk about the therapeutic uses. So first, they are used for obesity, attention deficit disorder, and also attention deficit hyperactivity disorder and narcolepsy. But with all these benefits, there are also side effects. There is no perfect drug, as they say, right? Let's start with the cardiovascular response of the body to the stimulants. Let's start with amphetamine. Amphetamine, for example, is given orally and it raises both systolic and diastolic pressure. For the CNS, its main effects include wakefulness, alertness, decreased sense of fatigue, elevation of mood, increased capacity to concentrate, and we also have elation, euphoria, and increased motor and speech activities. Next, stimulants have a direct effect on the medullary respiratory center and increase both the depth and rate of respiration. Lastly, stimulants cause tolerance and dependence, in which psychological dependence develops with chronic administration and tolerance to the anoxygenic effects of stimulants. This time, we'll be talking about the pharmacokinetics and pharmacodynamics of our CNS stimulants. If these drugs could indeed be helpful, how then did it entrap a lot of individuals into helplessness due to its potential for abuse? Why do many choose to risk their lives just to have a taste of this? Amphetamine, also known as a club drug, is taken initially in pills, but can also be smoked or injected. Within hours after oral ingestion, amphetamines increase alertness and cause euphoria, agitation, and confusion. These effects are primarily due to elevated catecholamine levels that increase arousal and reduce sleep. The dopamine system mediates euphoria, while serotonin transmission may play a role in the hallucinogenic and anorexigenic functions, as well as in the hyperthermia often caused by these amphetamines. Cocaine, also known as coke, could be taken in the form of cocaine hydrochloride, which is famously absorbed through nasal snorting. When heated in an alkaline solution, it becomes what we call the crack cocaine, which we can smoke. Inhaled crack cocaine is rapidly absorbed in the lungs and penetrates swiftly into the brain, producing an almost instantaneous rush. This activation of the sympathetic nervous system results mainly from the blockage of the norepinephrine transporter. Cocaine also blocks the uptake of happy hormone dopamine and serotonin and even noradrenaline through their respective transporter. This party drug, also known as Molly, is usually taken orally in pill, tablet, or capsule form. Onset of action is within 30 minutes and peak serum level occurs after 1 to 3 hours. The elimination half-life is approximately 7 hours. Ecstasy or MDMA interferes with the storage of serotonin within the vesicles and thus increases the amount of serotonin available to be released. These processes can lead to significant increases in serotonin available in the synapse. Methylene dioxymethamphetamine or MDMA has an amphetamine-like properties with several acute toxic effects, in particular hyperthermia, which along with dehydration may be fatal since users have attempted to compensate by drinking excessive amount of water, causing water intoxication involving severe hyponatremia, seizures, and even death. Other complications include serotonin syndrome such as mental status change, autonomic hyperactivity, and neuromuscular abnormalities, and also seizures.
Here are the factors that lead to substance abuse. The use of illicit drugs is primarily influenced by environmental factors. Easy accessibility of drugs has been one of the current situations among the youth. Rationally, when accessibility of drugs is easy, chances of people trying out and consequently being addicted to drugs is increased. Hence, accessibility of drugs is an issue requiring immediate attention so that actions could be carried out to minimize or eliminate possible negative effects. There are biological mechanisms responsible for humans' variety of sensations in the brain, inclusive of pleasurable sensations, wherein it is through the activation of this pleasure pathway that an individual experiences pleasurable sensations or feelings. Therefore, the consumption of illicit drugs activates this pleasure pathway and consequently produces the pleasurable experience. It is human nature to seek for pleasant experience. Therefore, augmenting this individual seeking out for the overall pleasurable substance consumption experience. Easier communication and interaction among humans because of advanced technology. The Internet's providing a diversity of benefits to human beings. Unfortunately, it is not without its advantages. The Internet has eased the transaction of drug selling, wherein the Internet has been a popular tool for marketing and purchasing stuff with just one click away. Stress stems from a variety of situations. Someone may feel stress from the poverty or also may feel pressured. Additionally, stress can take the form of abuse, whether it is sexual, physical, or psychological. The earlier someone uses drugs, the more likely they'll develop an addiction when they are older. One of the primary reasons for this is that the brain development is very significant during the teen years. Other factors such as risk-taking, genetics, mental illness, experimentation, gender and age, hedonism, and peer group. People who lived in a deprived state where the risk factors are high and the protective factors are low have a higher risk of using drugs. In terms of family, the important factor is how happy and stable your family life is, rather than whether you have two parents or not. If the parents are very involved and have provided structure for the children, there is a decreased chance that the children will use or abuse drugs. If the home environment is unstable and the parents are addicts themselves, or if they have some type of mental illness, it is more likely that the children may use and abuse drugs. And last but not the least, it's for a purpose. Some people use drugs to lose weight or to help them concentrate. Others may self-diagnose problems and use drugs to self-medicate. Lastly, from all of those mentions, with the changes in the globe in this new era, accessibility of drugs has increased. This scenario increases people's exposure and later probability to be involved in problem drug use. Therefore, in order to cope with the nation's drug use problem, related parties need to be aware of the contributory factors for better precautions and also
There
interventions.
should also be
awareness that the problem drug use is the result of the combination of several factors instead of just one sole cause. More effective methods need to be implemented to be better able to cope with the scenario in this technologically advanced era. Signs and symptoms of drug abuse. The clinical manifestations of psychostimulants include euphoria, increased energy or decreased fatigue, reduced need for sleep, decreased appetite and distractibility, increased self-confidence and alertness, increased libido, and prolonged orgasm, independent of the specific psychostimulant or route of administration. Peripheral effects may include tremor, diaphoresis, hypertonia, tachypnea, hyperreflexia, and hyperthermia. Many of the effects are biphasic. For example, low doses improve psychomotor performance, while higher doses may cause tremors or convulsions. Alpha-adrenergically mediated cardiovascular effects are also biphasic, with low doses resulting in increased vagal tone and decreased heart rate. The high doses causes increased heart rate and blood pressure. Stimulant use can result in restlessness, irritability, and insomnia, and at higher doses, suspiciousness, repetitive stereotype behaviors, and toxicity. Endocrine effects may include impotence, gynecomastia, menstrual function disruptions, and persistent hyperprolactinemia. Overdose presents as sympathetic nervous system overactivity with psychomotor agitation, hypertension, tachycardia, headache, and mydriasis, and can lead to convulsions, cerebral hemorrhage or infarction, cardiac arrhythmias or ischemia, respiratory failure, or rhabdomyolysis. For the last part, the pharmacological and non-pharmacological treatment.
The emergency and supportive measures is to maintain patient airway and assist ventilation if necessary. It rapidly lowers the body temperature of hyperthermic patients. Give intravenous fluids to prevent myoglobinuric kidney injury in patients who have dialysis. Then initiate a cardiac monitoring and electrocardiographic study. Gastric decontamination should be attempted with gastric lavage and activated charcoal if the agent was taken orally within the last 2 hours or if delayed gastric emptying is present. The drug of choice for seizures and agitation is benzodiazepine. Seizures should be actively managed with diazepam 0.1 mg per kilogram intravenous bolus. Monitor blood glucose and manage accordingly. If status of epilepticus pervenes, early aggressive management may be necessary to prevent hyperthermia, rhabdomyolysis, acidosis, and renal failure. Calcium channel blocker is the drug of choice for severe hypertension or blood pressure greater than 180 over 110 mm mercury. Nicardipine, initial dose of 5 mg per hour is recommended when increases in the infusion rate by 2.5 mg per hour every 5 to 15 minutes to a maximum rate of 15 mg per hour until the hemodynamic response is achieved. Once the target blood pressure is achieved until 160 over 100, the infusion rate can be reduced to 3 mg per hour and adjusted to maintain the desired endpoint. Severe hypertension needs to be controlled to avert intracerebral hemorrhage and encephalopathy. In the presence of tachycardia, labetalol may be useful. Propranolol are not recommended because of the subsequently unopposed alpha stimulation with the blockade of beta-2 mediated vasodilation and may worsen the hypertension and its accompanying complications. For patients who are experiencing supraventricular tachycardia, use verapamil 5 mg intravenous slowly 0.075 to 0.15 mg per kilogram. For cocaine, it is important to ensure adequate control of the ABC. Assess airway, position patient appropriately, or intubate if necessary. Administer supplemental oxygen and establish an IV line with 0.9% normal saline. Evaluate vital signs including temperature and obtain ECG. Gastrointestinal decontamination is indicated if the patient has clinical features of toxicity and ingestion. Use activated charcoal orally or via NGT if the patient has decreased level of consciousness and airway has been secured. If necessary, consider whole bowel irrigation. Hyperthermia requires aggressive and external cooling. Consider active cooling or decreased heat generation if the temperature is greater than 40 degrees Celsius with neuromuscular paralysis. Benzodiazepine is the drug of choice for agitation and seizures. It is the safest and most predictable. Seizures is usually self-limiting. If sustained, use diazepam 0.1 mg per kilogram intravenous or phenytoin 15 mg per kilogram intravenous by slowly infusion. Ecstasy. The management for ecstasy is to secure the ABCs as per level of consciousness and vital signs. Administer supplemental oxygen and intravenous normoxidine if indicated. Check blood glucose with regard to metabolic disturbances and prolonged physical exertion and supplement it if necessary. If the patient is clinically dehydrated, initiate isotonic rehydration and evaluate blood urea and electrolytes as soon as possible. Check temperature and initiate cooling measures if the patient is hyperthermic. Benzodiazepine is the drug of choice for agitation and seizures. Midazolam and diazepam 0.1 mg per kilogram intravenous. Cognitive behavioral therapy or CBT is a psychotherapeutic treatment modality that can be offered in an individual or group format. This promotes the development of alternative coping skills and focus on changing behaviors and cognitions related to substance use through self-control training like stimulus control techniques, social and coping skills training, and relapse prevention. Initial treatment sessions often involve developing skills directly related to achieving and maintaining abstinence, like drug use, self-monitoring, refusal, craving coping skills, and increasing social support and non-drug related activities. Later CBT sessions may focus on topics and skills indirectly related to maintaining abstinence, like anger, frustration, anxiety, depression management, impulse control, self-efficacy, and effective communication. Contingency management is an intervention aimed to eliminate or change specific behaviors that are closely related to substance use by utilizing reinforcement procedures or rewards.